How about we talk about where the nipple areola ought to be most of the time relative to other structures, and also where the inframammary fold ought to be. So typically, we look for a number when we're talking about the sternal notch to the nipple. We want that to be maybe 21 to around 23. For a very tall person, it might be 24 or 25. For a very petite lady, it might be 18 or 19. Let's say a 5 foot tall, 100-pound gal. So that's generally where they are. The other landmarks are, it's often at or above the inframammary fold. So this is the inframammary fold. Maybe that's right about there, okay? Or it's equal to a spot that's the midline of the upper arm. So those are some landmarks that we look for where the nipple areolar complex ought to be. Interestingly, I sometimes see people whose inframammary fold has gotten dragged down, often with a tummy tuck, or someone that's had massive weight loss. I consider the inframammary fold the zone of adherence, a spot where it's usually kind of tethered to your body, except if you're very old, if you've lost 100 pounds, or if you've had a tummy tuck and your skin was a little bit loose and it pulls it down. The tip-off to this is the inframammary fold should be nowhere near your rib cage, but sometimes it is. And someone will come in with a nipple to sternal notch of maybe 25 or 28, and yet the nipple is sitting right in the middle of the breast, but the whole breast is way down here. And this person has to wear their straps on their bra very long. And they don't really tumble to it, but we do. Because perhaps somebody had a massive weight loss and with a big implant and the whole breast has moved down, and then they want a tummy tuck. Well, if you try and do a tummy tuck on someone like that, that breast will literally drop off the rib cage and it will be way too low, and then it's a bear to fix. Sometimes when we're doing a breast lift on someone like this, we'll lift the inframammary fold and secure it to the chest wall and then do our lift there to get it back in the right spot. It can look normal, but this distance is really long, and that's a tip-off that something is awry. Massive weight loss, big implant, the breast shifted down, or a tummy tuck pulled it down. It's little things that happen sometimes that are unusual.